this video we will see what are the different asphyxial death. First we will see drowning. What is drowning? Drowning is mostly inside water. So sinking, submerging inside water, any other fluid. So not just water, any other fluid. It is drowning. Drowning, the fatal period is 5 to 8 minutes. For hanging we will see it was just 3 to 5 minutes, I think. 3 to 5 minutes was a fatal period in hanging. In drowning it is just 5 to 8. But drowning is mostly accidental. So drowning is mostly accidental, but it can be suicidal also and homicidal also. So drowning is there is typical drowning, and we will see then atypical drowning also. So typical drowning is wet drowning. Wet drowning. What is wet drowning? Wet drowning is the water entering inside the lungs, and death is due to the cardiac arrest. So water entering into the lungs and death is due to the cardiac arrest. There are two types of wet drowning. So freshwater drowning. So we will see typical drowning, and then we will see atypical drowning. That is dry drowning, cold water drowning, delayed drowning, delayed or near drowning. We will see. So first, in the typical drowning, we are seeing typical drowning example is the wet drowning. Wet drowning is simply water entering into inside the lungs, and that is lead to water entering inside to the lungs, and it is lead to cardiac arrest by several mechanisms. We will see how. So first is a freshwater drowning, then seawater drowning. Freshwater inside into the lungs, there occur hemodilution. After the hemodilution, the RBC. After the hemodilution occurs, the RBC release the potassium ion, and because of hyperkalemia, ventricular fibrillation occur. Ventricular fibrillation leading to the cardiac arrest and death. Seawater drowning. So hemodilution occur in case of the freshwater. While seawater, we know that there higher concentration of iron, so hemoconcentration occurs because increase in sodium ions, magnesium ion, also strontium ion. These are all high in the seawater and other electrolytes. And mainly sodium ion, there occurs hypernatremia. Hypernatremia leads to bradycardia and cardiac arrest. So there occur increase in sodium ion level leading to that is hypernatremia, that is lead to hemoconcentration, bradycardia and cardiac arrest. While seawater drowning, there is hyperkalemia leading to ventricular fibrillation and cardiac arrest. So what is a faster cause, freshwater drowning or dry water? Freshwater drowning is a faster cause, and in both the cases the loss of pulmonary surfactant occur. Atypical drowning, it is dry drowning. The example for atypical drowning is the dry drowning. So dry drowning, no water enter inside the lungs. Death is due to asphyxia. Asphyxia induced laryngospasm. Then cold water drowning, submersion syndrome, submersion, immersion or hydrofusion, and this is the same. So cold water, submersion, immersion or hydrofusion. With the cold water just touches the nose, ear and epigastrium part. Because of the reflex vagal inhibition, there occur cardiac arrest. Delayed drowning, near drowning, secondary or post immersion drowning, because death is delayed. After the 1 to, for example, you have drawn and you survive, but after 1 to 2 days you develop severe pneumonia, metabolic acidosis or severe encephalopathy, then you died. It is called as secondary drowning, post immersion syndrome, delayed drowning or near drowning. Cold water drowning is simply immersion, submersion or hydrofusion. Dry drowning is due to asphyxia induced laryngospasm, not due to the cardiac arrest. You are drowned. So this was the all type of the drowning we've seen. We've seen typical drowning, that is wet drowning, freshwater and seawater drowning. Freshwater, faster cause of the death, and we have seen atypical drowning, dry drowning, cold drowning, and delayed near or secondary drowning. What are the antemortem changes that occur? Antemortem changes means death is occurring in the water. We have seen that in drowning we have seen as cataleptic rigidity, instantaneous rigor or cadaveric spasm. We have seen cadaveric spasm, cataleptic rigidity or instantaneous rigor. We have seen the example that was ABC, asphyxia. We've seen all that. So asphyxia, brain death, cortical death, drowning, dinitroorthocresol poisoning, electrocution. We have seen all that. So electrocution, hyperthermia, hypothermia, and all trauma. So no electrocution was there. Dinitroorthocresol poisoning was there, and electrocution was there. Cataleptic agility. As all of we have seen, asphyxia, brain injury, cerebral injury, drowning, dinitroorthocresol poisoning, exhaustion. It was exhaustion, not electrocution, and firearm injury was there. Okay. So cadaveric spasm or cataleptic rigidity will be seen, and then water or mud particles in the GIT, water entering in the lungs, so conscious water entering into the lungs, and white copious mucoid, so white leathery copious mucoid froth, so white leathery copious mucoid froth will be seen. It is known as emphysema aquosum. After that, it comes out the nose and mouth. So if you are conscious water entering into the lungs, white leathery copious mucoid froth come out, so it is called as emphysema aquosum. And the swelling it is seen when you are unconscious is called as edema aquosum. What is the non-mucoid froth is not non-mucoid froth also occur in snake bite, electrocution, and epilepsy, pulmonary edema, putrefaction, decomposition, putrefaction, pulmonary edema, snake bite, and strangulation also non-frothy, non-mucoid froth is seen. Because of the force expiration in the drowning, alveolar rupture can occur, and subpleural hemorrhage in the drowning are the Pulthoff hemorrhage. Okay. So what all we have seen the postmortem changes in the drowning. So what we have seen postmortem changes. First we have seen that in antemortem drowning what happens. In antemortem drowning what happens, postmortem changes, we've seen cadaveric spasm. The cadaveric spasm occur, or what we call cataleptic rigidity that can be occur. And also we've seen when they are conscious, white leathery copious mucoid froth will be seen, edema aquosum when conscious, and when unconscious, edema aquosum. So mud particles into the trachea up to the secondary bronchi, mud particles end up. And due to force expansion, they are saying that alveolar rupture can also occur, and see Pulthoff hemorrhage or subpleural hemorrhage. And they are saying non-mucoid froth occur in the snake bite, strangulation, in decomposition, putrefaction, pulmonary edema, epilepsy also non-mucoid froth can often be seen. Now what they are saying about the Gettler test is a chloride ion concentration. Gettler's test is chloride ion concentration. Normally both chamber contain the equal concentration. But seawater drowning left chamber will be higher, and in freshwater right chamber will be higher. If more than 25% difference is the indicative of the antemortem drowning. And strontium concentration on the left side is, strontium is more in seawater, no? So strontium concentration in the left chamber is suggestive of the seawater drowning in the left chamber. And now they are saying about the diatoms. Diatoms are the unicellular alga. Diatoms less than 60 micron goes from lungs to the distant organ. So diatoms, they process the lung, pulmonary, capillary, and they go to the distinct organ. Because of the well-developed Haversian canal system in the bone, they are mainly found that concentration from the blood. They go to the bone, to the Haversian canal system. The best bone is a femur. Most commonly, it's a sternum because it is easy to withdraw. And the best organ is bone is also an organ, but apart from bone, best organ is spleen. For the detection of the diatoms for the bone, acid digestion test is used. Acid digestion test is used for the detection of the diatoms. So what is this acid digestion test? In which the nitric acid is used and bone get digested, bone get digested, and diatoms remain same. Diatoms remain same. So diatom less than 60 micron only they enter. Next, all what we have different type of diatoms. So oligohalophilic of the fresh water, polyhalophilic of the sea water. So now we see other non-specific finding in the scene in antemortem or the postmortem. For the washerwoman hand, flotation of the body, cutis and serina. These three are seen. So, other non-specific findings, which are non-specific. So, washerwoman hand, flotation of the body occur because of the gas formation. We know putrefaction and decomposition. In summer, only 1 day they are taking, and 1 to 2 days in the winter because decomposition rate is slow. So, wrinkling of the skin, bleaching of the skin, soddening of the skin, and cuticle getting peeled. Wrinkling just 3 to 4 hours, 12 hours for the bleaching, 24 to 48 hours, 1 to 2 days for soddening, and 3 to 4 days for cuticle of the skin getting peeled off. And cutis anserina is just skin showing because of the piloerection skin showing puckered or the granular appearance of the skin. Higher level of serum strontium and magnesium in left ventricle, we said that it was because of this diagnosis of seawater drowning. For the finding of the dye atoms in the tissue, we also seen that dye atoms less than 60 micron enter into the bone due to the well developed Everson canal system. Apart from that, we are also seeing Sehard sign. So several signs are there: Sehard sign, Whittler sign, Svashnikov sign, and Sebinsky sign. Sebinsky sign is very easy. In the drowning person, the small and anemic spleen is there. This is the Sebinsky sign. And free liquid comes in the paranasal sinus, mainly maxillary sinus or sphenoid sinus. Mainly, this is Svashnikov sign. Whittler sign, if gastric content is put into a beaker, gastric content is put into a beaker. Oh, where is the beaker? If gastric content is put in the beaker itself, gastric content is put into the beaker, the bottom will be have the solid in the lower part, the bottom most liquid in the middle, and froth. What you have seen that was leathery, white, mucoid, copious froth that was coming in the conscious drowning will be on the top, the gastric content. Also, we have this Whittler sign. This was the Whittler sign, and Sehard sign is a micro rupture of the stomach mucosa because of the overstretching, because the stomach it is getting filled with the water. So these micro ruptures occur in the stomach mucosa. So these are the this was the Sehard sign. So these are all the sign we have seen. So what all we have seen in this chapter, we have seen the drowning. We have seen typical drowning and atypical drowning. Typical drowning, we see freshwater and seawater drowning. Freshwater drowning is because of the hyperkalemia ventricular fibrillation. Seawater is due to hypernatremia and bradycardia and loss of pulmonary surfactant in all that. And it takes 5 to 8 minutes, mostly accidental cases. Atypical drowning is dry drowning just because dying of the laryngospasm due to asphyxia. Cold water drowning, submersion, immersion, or hydrocution is due to reflex vehicle inhibition when cold water touch nausea and epigastrium. Delayed drowning near secondary post-immersion drowning is due to pneumonia, metabolic acidosis, severe encephalopathy. Then we have seen cadaveric spasm was there, and white, leathery, copious mucoid frothing. That is what WLCM was there. It is emphysema ecosum and edema ecosum when unconscious. Emphysema ecosum when conscious. And we have seen the snake bite in strangulation, epilepsy, decomposition, putrefaction, pulmonary edema, electrocution, epilepsy. That was non-mucoid froth. And force expiration, the rupture of the alveoli. Then we have seen the test, the Gettler test. The left chamber was having high in the seawater drowning, and right chamber was having high in the freshwater drowning. More than 25%. This point is to be known. More than 25% in the chlorine concentration suggestive of antemortem drowning. Then see in the diatom, what test was acid digestion test, and best bone is the femur, best organ is the spleen. Then we have seen non-specific finding was washerwoman sign. Flotation is just because of the gas formation. After the decomposition, putrefaction, there was this gas formation. And cutis anserina, the puckered or the granular appearance is seen. Then we have seen several signs. We have seen. This sign is a sad sign is a micro rupture of the stomach mucosa. We have seen Wedler's sign when the gastric container put in the beaker, how they arrange themselves, and Sveshnikov sign. Sveshnikov sign we have seen, and Savinsky sign, which is a small congested anemic spleen. It was Savinsky sign.